Hi, everyone. It's such a pleasure to be invited to the Smile Train Cuff Care Symposium at the West African College of Surgeons 62nd Annual Scientific Conference. I'm Kris Torgeson. I'm the Global CEO of Lifebox, and just delighted to be in Monrovia in person. And for those of you who couldn't make it, on screen to present a quick overview of the strategic partnership that Lifebox and Smile Train have developed together, and talk a little bit about our work together in West Africa. So for those of you who are not familiar with Lifebox, Lifebox is an international nonprofit organization that makes surgery and anesthesia safer worldwide. We work through tools, training, and always in partnership to make surgery safer for every patient, every time. That's our goal. We've worked in over 100 countries, trained 11,000 healthcare providers in safe surgery, and with our pulse oximeter and other tools and training, feel that we've reached some 35 million patients. We work across three core pillars of safer surgery, and those are anesthesia safety, surgical teamwork, and surgical safety, with a real focus on reducing surgical site infections. As I said, we always work in partnership, and we work through tools and training, working with teams who are working in their own hospitals or with other organizations, and work with them to improve anesthesia and surgical safety through teamwork and other programs. One of the most exciting developments for Lifebox over the past 2 years has been an incredible partnership that we have built, thanks to the support and an initiative of Smile Train. The Smile Train Lifebox Safe Surgery and Anesthesia Initiative is a multi-year strategic partnership to elevate the quality and safety of cleft and pediatric surgery in more than 70 countries. We're working through capacity building, innovation, and research to strengthen the surgical systems of over 1,000 hospitals around the world. The initiative addresses the gaps in cleft and pediatric surgical and anesthetic care, but at the same time, strengthens the wider surgical system as a result. And this is a really important aspect of this partnership. We've just completed the first year of the partnership and really proud of some of the accomplishments and also setting up some of the groundwork for our current and future work together. We adapted and delivered a pulse oximetry workshop several times. We've delivered online events and webinars. Because of COVID, we developed together, also with WFSA, the COVID-19 surgical patient checklist training, both in English and French, and have delivered that online in many times now. We also launched the perioperative COVID-19 report, Resources and Safety, advocating for resources and training for frontline providers. You can find that on both of our websites. And we've also finalized some measurement and evaluation tools for measuring the impact of our work together. And that's just in year one. In year two, we are launching, and I have a few examples of them here with us today, for those of you who are in Monrovia. We're launching the Lifebox Smile Train Pulse Oximeter. And this is just a new generation pulse oximeter, co-branded together with Smile Train, and very much looking forward to putting pulse oximeters in the hands of more anesthesia providers around the world. We're also developing a really exciting new project, which is a low-cost, high-quality capnograph solution for even safer anesthesia and surgical care. We're also piloting a Lifebox program called Clean Cut, which is designed to reduce surgical site infection. We're going to be launching that in 3 sites for cleft in sub-Saharan Africa this coming year. Just getting started. Just to say a few words about the work we did together with Lifebox and Smile Train due to the COVID-19 pandemic. As I mentioned, we now have a Lifebox Smile Train pulse oximeter but we didn't really wait to make sure the co-branding was on. We went ahead because of the dire need for pulse oximeters, which we all know, particularly those clinicians here at the conference and online, know that pulse oximetry is essential for COVID treatment and diagnosis. So during the pandemic, we have delivered more than 8,000 pulse oximeters across 49 countries, primarily through anesthesia networks, so that we know they are both going to be used for COVID care as well as for safe anesthesia care. We're very proud of this. As you can see, over the past year, these pulse oximeters have gone all over the world, from Morocco to Ethiopia, with Burkina Faso, Sierra Leone, Benin, mentioning many of the West African countries that we have delivered pulse oximeters to. And just a note of Dr. Atugwawande, who is one of the founders of Lifebox and the global ambassador of the partnership, prior to Dr. Milier Debreu, who's taken over this past few months, also tweeted about how excited he was about this work. I think one of the more critical initiatives that we put together on COVID-19 response, as part of our COVID-19 response, is the COVID-19 surgical patient checklist, together with the World Federation of Societies of Anesthesiologists and Smile Train. We've now trained and done training of trainers of 134 surgical team members and carry out 17 workshops, and know this has been used in providing safe care for patients during the pandemic. For West Africa, we have a lot of plans, and one of the reasons I really wanted to be in Monrovia for this meeting, in addition to seeing so many colleagues and friends, new and old, is we have more plans for distributing pulse oximeters. We're piloting clean cut for cleft in a francophone country, in Cote d'Ivoire, in Ivory Coast, in Abidjan. We'll also be increasing our capacity by recruiting a program coordinator for clean cleft in Ivory Coast, along with a new fellow. So really look forward to coming back to the next WACS meeting with even more activities having taken place in West Africa. Here in Liberia, we began working in 2012, first with pulse oximeters. Many long time relationships built over the years between Lifebox and anesthesia providers in Liberia. Over the past couple of years, we've now had a team here led by Dr. Clarence Yaski, who's here, and a number of wonderful fellows who are key members of the Lifebox Liberia team. And Dr. Chasir Itam and Dr. Goya, along with Marlene Topka, who are just wonderful members of our team. They've been implementing checklist implementation strategies at 5 hospitals here, and are now starting to work on other aspects of Lifebox's work in the country. Most exciting, I think, is the implementation of our surgical site infection reduction program, Clean Cut, which has been piloted in Ethiopia with great results, and will now be implemented in a number of sites in Liberia, and this includes at Redemption Hospital, as well as at CB Dunbar Maternity Hospital, under the great leadership of Dr. Goya and his many colleagues. If you have a chance, please check out our website and look at the Lifebox Learning Network, where you can get many of our training tools online, and we'd love to have you sign in and sign up, and we're going to be adding more courses and training modules in the coming years. So thank you so much. Thanks to Smile Train for inviting us. Thanks for such the warm welcome at WACS. And we look forward to doing many great things in this partnership, and look forward to hearing from all of you. Thank you.